Back live with you tonight here on In Focus, and thanks for staying on. The South African Medical Association says the National Health Insurance Bill was developed without legitimate concerns of experts. It says that the bill in its current form doesn't address critical issues such as benefit packages and reimbursement models and the introduction of contracting units for primary health care. DA Member of Parliament Michele Clarke joins us now for more on this conversation. You can be a part of this conversation as well by sending us your thoughts on 072-110-5584. And the question we're asking you tonight, would you support the implementation of the NHI if it means raising of taxes? What are your thoughts tonight? Michele, good evening. Good to have you, and thank you very much for your time.
Good evening, Taba, and thank you for having me on your show. I would also just like to extend our condolences from the Democratic Alliance in terms of the untimely death of Eusebius Makaza, a really brilliant-minded journalist, and it's really such a sad event, his untimely death.
Yeah, no, indeed, quite a moving moment, I suppose, in the journalism fraternity, but also in the nation as a whole. But part of the issues that Eusebius, as I'm sure, would have also been dealing with are these issues that are happening around policy within our government, and NHI being one of them. Now, Michele, if we were to broadly look at the intention of universal coverage as defined by the WHO and other health bodies, is to improve equity in the use of health services, and this means that the services of quality are spread throughout all members of society, irrespective of their socio-economic standing. Do you believe that this is something that certainly can be attained in South Africa?
To be very clear, the Democratic Alliance supports unequivocally quality universal health care. But under the current environment that our health care operates at the moment, I do not think that the NHI bill will realize that outcome. And because there are so many gaps within the bill that, would also restrict that outcome in terms of equitable health care for all in South Africa.
Yeah, one of the issues, I mean, you've got 50, we won't probably get through all of them, but we'll try to get through as many as we can tonight, is the issue of the funding and how this is going to be funded. Why do you believe that would be a stumbling block? I mean, there are various funding models of universal healthcare and of healthcare services in general. One is revenue raising, two is pooling funds, and the other one is purchasing of services. Why do you believe the idea of approaching it via the pooling fund approach is not going to work in South Africa?
Well, firstly, it's the track record we have in terms of government. So the NHI provides for a single service provider, and what they would then do is contract in medical aid and healthcare workers over a period of time, which that would also, the medical aid services that will be contracted in to assist will over time also be phased out. So, as far as we're concerned, the Minister of Finance, when he did his budget speech, didn't mention the funding in terms of NHI at all. We have asked for the feasibility study in terms of NHI, as well as the funding model, to be presented to the committee at each and every meeting we've had, and we've just had that fallen on deaf ears. So that is a very worrying factor, and they really are saying that, we will raise taxes in order to fund NHI. Now, in this current economic climate that we operate in South Africa at the moment, many people can barely afford to put a plate of food on their table, let alone for a new tax to be introduced in order to fund NHI. So that's the one big concern. And then, of course, around the constitutional issues of NHI is a very big concern because, you know, Section 27 of the Constitution clearly states that all South Africans should receive quality health care. So if you've been receiving good health care and you can afford a medical aid, you're certainly not going to be getting the same quality health care from a state hospital.
Right.
And I can tell you why, because the services within our hospitals and state hospitals, you know, first of all, your infrastructure is crumbling. You have severe staff shortages. You have severe specialized healthcare workers shortages within that area. And until we can ensure that our environment that we function in terms of healthcare is brought up to a standard where we can supply quality universal healthcare to people in South Africa, we're never ever going to get to that point. So what will happen is if you go to a state hospital, they will make a decision who is going to treat you, whether they will send you to a private hospital or to a state hospital for treatment. And then, of course, there's the aspect that's very worrying because the bill is very unclear as how you go about getting a second opinion if you're not happy in terms of your health care that you've received. And obviously, if you are used to a certain quality of health care, through private health care because you are able to afford a medical aid and your health care is reduced to substandard health care, that is totally against the Constitution as well.
But are you saying you do not believe that we could improve coverage while we deal with all these other issues that are linked to what you're saying, efficiency, meaning quality, and quite key is equity of distribution. In other words, the same kind of distribution that is not based on whether or not you are economically well off and therefore can afford a type of quality of healthcare, but it is equally distributed. And two, to address your issues on concerns around corruption in a manner that is transparent, but also in a manner that holds people accountable.
Yes, well, you know, government has really not got a good track record when it comes to fraud and corruption. And, you know, NHI would just be another SOE, and we all know what's happened to Eskom and SAA and the likes of Transnet. And it would be falling under the same bracket. I believe that, you know, for healthcare, in order to function properly in this country, we need a blended approach. So the medical aid councils should legislate legislation so that private medical aids actually produce medical aids that are affordable for those who can afford affordable medical aid depending on their income. And that would take a huge burden off the state. So where people that actually can't afford medical aids, there would not be such a huge amount of influx into healthcare systems. And of course, you will then be able to provide far better healthcare. So the private sector really also has a huge role to play in, you know, as far as we're concerned, in order to achieve a blended approach in terms of healthcare in South Africa, so that we can ensure that we can then have equitable health care to all South Africans in this country.
Why are we not then, therefore, Michele, pushing for, as you're saying, reforms in collection? Others are even suggesting, as you say, they might be raising taxes, but agree on a flat rate that will be collected across the board, irrespective of who you are and how much you earn. Just because you can afford a 20,000 rands package of medical aid and somebody else doesn't, it doesn't matter. We all pay a flat rate in terms of collection, push for those reforms, and then we all benefit equally from the health system. Or two, push for reforms in how we're going to pool this money together and what needs to be put in place. Or come up with policies that says how we're going to guard against this becoming another failed SOE. And three, as you put it, maybe you could put reforms around the benefits and how they are designed, depending, I suppose, on your previous medical history and what you would need to be paid for, so that it does not put you at a disadvantage.
Yes, you see, it is very difficult to push for certain reforms if government has not presented a costing model of the NHI to us. Because, you know, you have to see what NHI is going to cost the South African taxpayer and the South African government in order to see which reforms would probably be the best implemented in order to ensure that you have equitable healthcare in South Africa. And like I said before, I think the private sector has a big role to play in order to assist to achieve that, and a blended approach is something that we really need to look at. And we did speak about that when the Medical Council did their presentation on their budget to us, that is something that really needs to be looked at, so that you have almost subsidized medical aids for those who are not in a high income bracket in order to assist.
Yeah.
Then also, sorry.
Yeah, no,
sorry,
go for it.
Yes.
You can finish your thought there.
Okay. But then also there's another huge concern, and that is the role that the minister plays. So the minister is really the jury and the judge in terms of this whole bill, and separation of powers is really not being looked at how the minister is going to be managing this, and obviously he appoints the board, he appoints all the commissions, and then has to report to cabinet on, appeals, the appeals committee, for instance, and what the board has decided on. And that is very worrying for us, because we believe that Parliament should be the oversight body of NHI if NHI is implemented.
Yeah. So if our goal, and as you said earlier on, the Democratic Alliance believes that certainly universal coverage would be the way to go, how can we influence for progress instead of putting obstacles in the way of universal health coverage for the entire population? How can we influence progress towards that direction without taking the minister and the department to court at every turn to try and get this off the ground?
Well, I think how we influence that is by making sure that we have policy in place that assists those reforms. And, once this bill comes to Parliament, and obviously will then go to the NCOP, the Democratic Alliance is busy formulating their own health policy. And we will certainly link that health policy into a private member's bill and take that to Parliament.
Yeah. The other issue that you're raising here is the question of losing of talent. Do you believe that the NHI will cause a brain drain, and why?
Absolutely, it will cause a brain drain, because I think, number one, if you look at the track record of government and their payment history, in terms of a 30-day payment history, that really is non-existent. And I'm sure doctors that are going to be contracted into the NHI system and are told to operate at a certain rate, and they are not going to be paid when they should be paid, will certainly get to the stage where they will leave the system and go abroad, and we hear that from a lot of the medical teams when we speak to medical people, saying to us, professional medical people saying to us that they will leave the country, and that's not just with doctors. That's the same issue around the specialized nursing care.
Yeah, I was listening to I think it was the Deputy Minister speaking recently, and he's saying that there's really no reason to believe that doctors would be paid anything less than what they are currently paid right now. And the WHO says there are two reasons why we are seeing brain drain. One is doctors moving to places where there are better wages, but two, moving to places where there is better working conditions. So if they are not going to be getting paid any less than what they are paying, and if this is going to improve their working conditions, if indeed the services are going to be improved, why would they want to go?
Well, that's not clear within the bill. So, this is why we are saying there are so many grey areas within the NHI bill. It is not this legislation does not talk about what the remuneration would be, what the conditions of employment would be in terms of medical doctors and nursing staff. And so it's very unclear to everybody actually what government intend to do when it comes to those conditions. And that is also one of the big reasons we've asked for these presentations, so that we are aware of what government's thinking is around conditions of employment and remuneration.
Right. Michelle, appreciate your time. Thanks so much for coming on and joining us tonight here on In Focus. That is a Member of Parliament, Michele Clarke. They're saying they're already looking into this matter quite close, and they'll be preparing a private member's bill also to bring around the issues of NHI. A question we're asking you tonight on 072-110-5584. Would you be prepared to pay a little more tax, indeed, to head towards progress as far as universal coverage is concerned? Ozzy, here's what he's got to say. This government is not able to manage any SOE. Look at Eskom, Prasa, SAA. I cannot go on, I can go on and on. Why should I now trust they will manage NHI differently? I will rather pay higher medical aid knowing that my money will save me when I need it and not be stolen through corruption. Anup from Johannesburg saying currently our healthcare system is unfortunately heavily inequitable for a developing country. If raising taxes improves the lives of the majority, then we need to do it. Much appreciated. Thank you so much for your thoughts tonight to that conversation. In Focus continues shortly, and we'll in conversation around the performance measures put in place by the Department of Justice and Correctional Services. Stay with us.